All right, we're back now with details on how the coronavirus is being detected and transmitted. The American College of Gastroenterology, based in Bethesda, wants people to know you need to watch out for more than just respiratory symptoms. Fox 5's Sharon Roger is live at the CDC offices in the district with the story. Sharon?
Yeah, Sean, we're still waiting on official comment from the CDC. But to break this down for you, the American College of Gastroenterology, which represents thousands of doctors from around the world, they've been studying these cases of coronavirus out of Wuhan and here in the U.S. And what they're finding is that this virus is not only spreading through respiratory symptoms, but with GI symptoms, which frankly is not being talked about a lot, especially diarrhea.
We are getting the information as it's coming out of Wuhan and also Italy and other places where this is infected, is that the GI tract probably plays a much larger role than thought previously.
Novel coronavirus symptoms, according to the CDC, seem to be mostly focused on fever, cough, and shortness of breath. But Dr. Mark Pachapin, the director of gastroenterology at NYU and the president of American College of Gastroenterology, based in Bethesda, says there should be another focus.
It's important for people to recognize, with new information coming forward, that diarrhea may be more commonly seen early on in the presentation of COVID. And this is something that we're not really accounting for when we take a history. We're looking at fever and respiratory symptoms, so people just have to be aware of this.
This is significant because Dr. Pachapin says early detection is key and some cases could be missed. He says about 50% of the 200 COVID-19 cases studied out of Wuhan, China, had presented diarrhea even before respiratory symptoms showed up. So what do these findings mean for someone who develops diarrhea now?
Truthfully, diarrhea is so common that we shouldn't panic. But I think it has to be put in the bigger picture. Did they have contact with anybody who had any significant exposure? Perhaps they can self-quarantine just to see how their symptoms progress.
The doctor says while there's been a lot of discussion about the respiratory spread of this virus through droplets, there's also the potential for fecal-oral transmission.
The virus is in the stool, and it is possible that after using the bathroom, we can contaminate a doorknob, a tabletop. If we touch somebody, we may actually transmit the virus in that way. So it's critical that people wash their hands.
Yeah, again, critical for people to wash their hands. That's a big message again with this. But the Institute says understanding how this virus presents and spreads is key. They just hope the CDC makes notes of their finding and that clinicians can identify people with GI symptoms and monitor them. Back to you.